Hello and welcome to Time with Dr. Racheal. Yes, we're back. All right, today I'll be talking more about an interesting topic. Everybody wants to know about you, and so that is PCOS. Most people call it PCOS, but what it fully means is polycystic ovarian syndrome. Some people just say have hormonal imbalance. Some people don't even know what they have. And some people overdiagnose themselves and say, oh yes, I have PCOS, when they don't really have PCOS. So there is a criteria you need to fulfill to say you have the syndrome. You could have some features, that is one or two symptoms that could be a part of the PCOS, the PCOS syndrome, but you may not entirely have this syndrome, and that's why we're discussing this today. So women with PCOS are said to have hormonal imbalance, and that's because they have two or more of these symptoms. Either they have prolonged length of their menstrual cycle, so instead of you seeing your period every 28 days through to 35 days, you're going on to have your period maybe once in 3 months, 6 months, and then back. Also, they need to, of course, be in a reproductive age group. That means they need to be, old enough to have started seeing their periods. And these women usually could either have excessive hair growth to show that they have a lot of male hormones within them. When you come in for an ultrasound scan and we find out that you have lots of little bags of water, like a pearl chain around the ovary, that's where that's the powerhouse of women. That's all the hormones are happening and all. Now inside this pill, if you have it's an increased number of follicles in the ovaries, it also pointers to you having PCOS. So what do you need to do about this? Now, PCOS has different angles to it as regards to when it actually occurs in your reproductive lifetime. For some women, it starts by them gaining weight. Now, women with polycystic ovarian syndrome have challenges with weight loss, and that means that it is quite easier to lose weight without the PCOS. First, you have to discover that this is what is going on with you. See your doctor, have your blood samples taken, and have yourself evaluated to find out, do you have any other symptoms of PCOS? Do you have any health challenges that are being managed for? Are you on any medication? These are the things that would help to know exactly how to make a tailor-made treatment for you. But let's delve down into this weight loss. You sometimes need a gym instructor, an exercise instructor to help you with the weight loss. Also, you need to watch that. Yes, some women are on the big side. I mean, you go through your pictures from secondary school, union, and I'm like, what's going on here? All this time I was told I was fat. I wasn't even fat. Can you imagine that? They made me lose all that time. I thought I was fat, but I wasn't really fat. Yes, women with PCOS get that. So you need to know what is the preferred weight to height ratio for you. The specific ratio that you should fall into, and that's why you also need to go in with your doctors knowing all of this about you. So your diet plan is important, your exercise routine is important. Now, because it's polycystic ovarian syndrome, sometimes we need to deal with it in other ways. You may need to be placed on some medications because it's said that these hormones can actually change to are very difficult. You have something called insulin resistance. That means your body just does not respond to the hormone that's supposed to break down the fat and the sugar in your body. It's like, no, I'm here to stay. And then you go, why? You will do all you can and you're not winning. Then you need to check it. It just may be PCOS. So with all of this I've said, after you've done your exercise and weight loss, Of course, a team of doctors, a team of specialists need to be involved to have checks on you, your exercise instructor, your diet instructor. You need to have a nice diet plan. Then medications to help to reduce that insulin resistance. Like, insulin, you need to leave me alone. You need to work hard. My body needs to accept you. We need to be friends. Okay? And there's some medications that can help you do that. So if you want more information about that, we'll talk more about that, in details. Now, if all of this is happening and it's still not working, there are other interventions we need to get you up to speed with, other medications you may need to use. And there are situations whereby after you've done all you're meant to do, you're not winning. Then you may even need to go as far as having some weight reducing surgery or some injections that can help you lose weight. But I need you to know that when you have PCOS and you're having difficulties with losing weight or challenges with weight loss, you do not need to give up. Why? Medicine has made a lot of things easier, a lot of innovations that have come to stay. And so the first thing we need to know is your weight loss because of PCOS? And if yes, then we know what to do. So you know what you need to do for me now? Write in the comment section. Let me know if this was helpful. Subscribe to our channel. Turn on your notification buttons. Alright, and like our videos, and you get more from us. See you later. Bye.